The amendments before us today refine and strengthen Senate Bill number 1822, the National Autism Care, Support, and Inclusion Act. These proposed changes do not alter the heart of the measure, they deepen it. We align the bill with the Sustainable Development Goals to ensure that our commitments to persons with autism is not only compassionate but sustainable and measurable. We modernize definitions to reflect both science and dignity, recognizing neurodiversity, universal design, and the right of individuals on the autism spectrum to self-identify without hierarchy or stigma. We strengthen the National Plan of Action by requiring measurable targets, baseline service packages, geographic equity, and annual reporting to Congress because inclusion must be accountable. We institutionalize coordination, not only among agencies, but with researchers, professional organizations, civil society, autism self-advocates, and families, ensuring that policymaking is evidence-based and participatory. We reinforce our health system by addressing workforce gaps, expanding PhilHealth coverage, integrating gender-responsive diagnostics, and establishing integrated referral networks. And we strengthen inclusion in education, employment, and community life through concrete mechanisms, not merely aspirational language. Mr. President, I would also like to sincerely thank Senators Pia Cayetano, Sherwin Gatchalian, Joel Villanueva, and Lauren Legarda for their thoughtful and substantive amendments, which have enriched this measure and made it more responsive, more accountable, and more inclusive. Likewise, we recognize the invaluable insights of autism self-advocates, parents groups, professionals, and civil society organizations whose lived experiences and expertise continue to guide us in crafting a law that truly reflects their realities. In sum, these amendments transform the bill from a statement of intent into a structured, measurable, and rights-based national framework. I respectfully submit these amendments for the consideration and support of this chamber. Thank you, Mr. President. First of all, yes, Mr. President.
Yes, you may proceed.
Thank you, Mr. President. In Section 2, Declaration of Policy, and this is from Senators Joel Villanueva and Pia Cayetano. On page 1, line 9, after the word screening, comma, insert the word diagnosis, comma.
You're amending line 9.
Line 9, Mr.
After
President.
screening on line 8.
Sorry, Mr. President. Yes, I stand corrected, Mr. President. After the word screening on line 8.
On line 8, correct.
Yes, Mr. President. Insert the word diagnosis, comma. On the same page and line, after the word timely, insert the phrase and evidence-based. I so move, Mr. President.
Evidence-based. Anyway, any objection? Hearing none, amendments adopted.
Thank you, Mr. President. On page 1, still, line 10, after the word families, insert the following. In accordance with the Sustainable Development Goals, SDGs, for good health, quality education, decent work, and reduced inequalities. These policies, programs, and services shall contribute to sustainable development by building inclusive societies that leave no one behind, ensuring long-term equity, empowerment, and advancement for persons with ASD. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. In Section 3, definition of terms from this representation, on page 2, delete lines 6 to 10 and replace with the following.
6 to 10.
Yes, Mr. President. And replace with the following. A, autism or autism spectrum disorder, ASD, refers to a neurodevelopmental condition characterized by persistent differences in social communication and interaction, and restricted or repetitive patterns of behavior, interests, or activities as recognized in the Diagnostic and Statistical Manual of Mental Disorders, DSM, and the World Health Organization International Classification of Diseases, ICD-11, where autism spectrum disorder is classified under neurodevelopmental disorders. I so move, Mr. President.
Any objection? Hearing none, the amendment is adopted.
Thank you, Mr. President. On the same page, line 11, after the abbreviation ASD, insert the following. References in this act to persons with autism spectrum disorder, or autistic persons shall be understood as equivalent and non-hierarchical, and shall not be construed to diminish the dignity, identity, or self-identification of individuals on the autism spectrum. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. On the same page, between lines 21 and 22, insert a new subsection EF to read as follows. E. Neurodivergent refers to individuals whose neurological development or functioning differs from what is typically expected, including but not limited to persons with autism spectrum disorder and other neurodevelopmental conditions recognized in the Diagnostic and Statistical Manual of Mental Disorders, DSM, or the World Health Organization International Classification of Diseases, ICD-11, for purposes of determining appropriate supports and reasonable accommodations under this Act. I so move, Mr. President.
This forms part of Section 3.
It forms part of Section 3, Mr.
All right.
President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. Letter F, universal design.
Still on Section 3.
Yes,
Letter F. All right.
also of Section 3, Mr.
Go ahead.
President. Universal design refers to the design of products, environments, programs, and services to be usable by all people to the greatest extent possible, without the need for adaptation or specialized design, consistent with internationally recognized disability frameworks and existing Philippine accessibility laws. Universal design may include sensory-inclusive design approaches that accommodate differences in sensory processing, cognition, and regulation, particularly in settings intended for individuals on the autism spectrum. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. Still in Section 3, definition of terms. This is from Senator Sherwin Gatchalian. On page 2, line 20, after the words Republic Act number 11650, insert the phrase, or the instituting a policy of inclusion and services for learners with disabilities in support of Inclusive Education Act. I so move, Mr. President.
All right. The Secretariat and I were smiling because it's an anterior amendment, but
Oh,
it's okay.
I
There's no one.
apologize, Mr.
No one is
President.
objecting. So any objection? Hearing none, adopted.
Thank you for the, I see now the error and the correction. Thank you for the correction,
all right, no
Mr.
problem.
President and dear Secretariat. On the same page, line 21, apologies, also an anterior amendment to the previous. After the word support, insert the phrase, aids and the implementation of the child find system. So that Section 3D shall now read as D. Inclusive education refers to the process of addressing and responding to the diversity of needs of all learners by ensuring full participation, presence, and achievement in learning environments, consistent with the Republic Act number 11650, or the Instituting a Policy of Inclusion and Services for Learners with Disabilities in Support of Inclusive Education Act, including the provision of reasonable accommodation and learning support aids and the implementation of the child find system. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. In Section 4, National Plan of Action for Autism Spectrum Disorder, and this is from Senators Joel Villanueva, Lauren Ligarda, and this representation. On page 2, line 25, after the word screening, comma, insert the word diagnosis, comma. On the same page and line, after the word timely, insert the phrase and evidence-based. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. On page 2, line 27, after appropriate social support for persons with ASD and their families, period, insert the following sentence. The plan shall provide for a baseline package of services accessible to persons with ASD and shall likewise provide a framework for needs-based service intensification, guided by objective criteria and rights-based safeguards to ensure equitable prioritization where service capacity is limited. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. On page 2, line 30, after the sentence ending with budgets of relevant government agencies and sectors, period, insert a new paragraph to read as follows. From this representation, facilities, programs, and services established or supported under this Act shall be guided by accessibility and universal design principles, consistent with existing disability and accessibility laws, to promote inclusive and usable environments. Further, from Senator Lauren Legarda, the plan shall include measurable targets and service capacity benchmarks for early detection, screening, diagnosis, and intervention services, including, as applicable, required geographic coverage, referral network standards, and time-bound access indicators such as maximum acceptable waiting periods from screening to assessment and initiation of intervention, with due consideration for geographically isolated and disadvantaged areas, GIDAS. The NCDA, in coordination with the DOH and concerned agencies, shall submit an annual implementation report to Congress detailing progress against these targets, service coverage gaps, and proposed corrective measures. I so move, Mr. President.
GIDAS will be in open and
Geographically
closed
isolated.
parentheses.
Yes, Mr. President, in
All
closed
right. Any
parentheses.
objection? Hearing none, adopted.
Thank you, Mr. President. In Section 5, Interagency and Multisectoral Coordination for Planning and Implementation. This is from Senator Pia Cayetano and this representation. On page 3, line 1, after the word with, insert the Department of Health, in parentheses DOH, Department of Education, in parentheses DepEd, Commission on Higher Education, in parentheses CHED, Technical Education and Skills Development Authority, in parentheses TESDA, Department of Labor and Employment, in parentheses DOLE, Civil Service Commission, in parentheses CSC, Department of the Interior and Local Government, in parentheses DILG, Department of Social Welfare and Development, in parentheses DSWD, other. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. On the same page, line 2, after the abbreviation, in parentheses LGUs, add the words, and in consultation with relevant. I so move, Mr. President.
That means in consultation with relevant civil society organizations.
Yes, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. The first paragraph of Section 5 will now read as, the NCDA shall lead in the formulation of the National Plan of Action for Autism Spectrum Disorder in coordination with the Department of Health, DOH, Department of Education, DepEd, Commission on Higher Education, CHED, Technical Education and Skills Development Authority, TESDA, Department of Labor and Employment, DOLE, Civil Service Commission, CSC, Department of Interior and Local Government, DILG, Department of Social Welfare and Development, DSWD, other concerned national government agencies, local government units, LGUs, and in consultation with relevant civil society organizations, autism self-advocates, parents groups, and other stakeholders.
As adopted. All right.
Yes, Mr. President.
You may proceed.
Thank you. In Section 5, interagency and multisectoral coordination for planning and implementation. From this representation. On page 3, between lines 3 and 4, insert a new paragraph that reads as follows. The NCDA, in coordination with the DOH, shall strengthen collaboration with academic and research institutions, including the University of the Philippines National Institutes of Health, UPNIH, in parentheses, the Jose R. Reyes Memorial Medical Center, in parentheses JRRMMC, and the National Center for Mental Health, in parentheses NCMH, and professional organizations specializing in neurodevelopmental disorder to support autism research, surveillance, data collection, and evidence-based policymaking. Such collaboration shall include, but not be limited to, the establishment of research partnerships, data sharing mechanisms, and the integration of research findings into the plan. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. In Section 6, Early Detection, Screening, and Diagnosis, from Senator Sherwin Gatchalian and this representation. From this representation, on page 3, line 12, after the word protocols, insert comma and the phrase, including approaches that are gender responsive and attentive to sex-based differences in clinical presentation in order to reduce the risk of delayed or misdiagnosis among women and girls. I so move, Mr. President.
Any objection? Hearing none, adopted.
Thank you, Mr. President. From Senator Gatchalian, on the same page, line 14, after the word professionals, insert comma, and the word specialists. Section 6 shall now read as Section 6, Early Detection, Screening, and Diagnosis. The Department of Health, DOH, shall integrate ASD detection and screening, referral, and diagnostic protocols, including approaches that are gender responsive and attentive to sex-based differences in clinical presentation, in order to reduce the risk of delayed or misdiagnosis among women and girls, into primary health care, maternal and child health programs, and other appropriate health services, and shall develop standard clinical guidelines and training programs for healthcare professionals, specialists, and workers. I so move, Mr. President.
Editorial amendment, you
Yes,
you
Mr.
no
President.
longer need the comma after specialists, right? Yes.
Grammarians debate that, Mr. President, but this representation, of
specialists and
course,
workers.
will submit.
All right. Any objection? Hearing none, adopted.
Thank you, Mr. President. Actually, Mr. President, it's impossible to confirm that we actually have that many.
That many, yeah.
109 is actually too few for 117 million Filipinos.
What is
But
the
since-
what is the ideal ratio?
For the okay. Ideally, Mr. President, it should be within the universal healthcare framework. It should be 1:100,000. Pero iba't ibang specialization.
Layo.
Of various
Layo.
specializations, Mr. President. But proportional, I guess, dun sa alam din nating ratio ng 1 out of 1 million ba? That on the average, 1 out of 1 million Filipinos or citizens of any country could possibly be on the ASD spectrum, Mr. President.
Yeah, so go ahead and answer the
So
original,
we are
the latter
pulling
question.
up as of our latest data, Mr. President, there are only 95,000 who have been diagnosed. Opo, and it might be a case of under-reporting or under-diagnosis dahil nga kulang pa ng up to this point in time isang comprehensive program ng DOH to assist families and parents to diagnose and to choose whether or not to intervene. A little more detail that I could make of record with the good gentleman from Bulacan, sa rehistro at yung mga na-issuehan ng ID, and na-issue ng ID, ilang porsyento lang kaya yun, mula 2021 hanggang 2025, may kabuoang bilang ng 98,245 ang nasa ASD spectrum. So, yun lamang yung exact figure that we have as of the end of last year, Mr. President. At malamang talaga underreported or underdiagnosed itong bilang na ito, Mr. Relation to the point raised by Senator Pia Cayetano, the good proponent may wish to consider this as an amendment to his amendment. That on that fifth line, coordination with the CHED, NCDA, CSC, PRC, the good gentleman from Bulacan may wish to consider also to include the Jose Reyes Memorial Medical Center as a national specialty center for the consideration of the proponent.
The idea being mentioned by the
Yes.
sponsor also, well, yes, but isn't it not very clear when we say healthcare services with persons with ASD, the DOH in coordination with yung binabanggit yung hospital, under the DOH yun eh. So
yes,
when
that
we
is
say
correct.
the DOH, it's encompassing of everything under the Department of Health.
That is correct, Mr. President, but I offered it as a proposed amendment to the amendment of the proponent dahil po ang JRMMC ay isang National Specialty Center na in charge din sa training nung mga medical professionals and specialists, including developmental pediatricians, Mr. President. If I may offer a formulation to the gentlewoman from Taguigan Pateros and the proponent, they may wish to consider the wording professional organizations specializing in neurodevelopment disorders.
Mas okay.
Professional organizations specializing in neurodevelopmental disorders, Mr. President.
I'm okay with that.
Okay ba yun? Professional organizations
Para mas
specializing.
Well, it becomes inclusive of almost everybody.
Just to make of record also, the value ng PhilHealth benefit package para sa mga persons with autism or nasa autism spectrum disorder is actually at 7,500 pesos.
I'm sorry, how much?
Napakababa rin, 7,500 lang po. At talagang it's dwarfed by, naalala ko yung statistic na ibinigay nung interpellation ni Senator J.V. Ejercito na maaring umabot sa 100,000, no, ang kabuuang gastos sa isang buong taon. So, what's 7,500 compared to that, Mr. President? Kailangan
Maraming
talaga
salamat po,
itaas.
Ginong Pangulo. Maraming
All
salamat.
right, but I understand that you have a proposed amendment to this effect.
Yes, Mr. President, it's actually the next one.
You may proceed.
Thank you, Mr. President. In a new Section 9, PhilHealth coverage and benefit package for persons with autism spectrum disorder. This is consolidating and harmonizing proposed amendments from Senators Lauren Legarda, Sherwin Gatchalian, Joel Villanueva, and this representation. On page 3, after line 19, insert a new Section 9 that reads as follows. Section 9, PhilHealth coverage and benefit packages. Persons with autism spectrum disorder, in parentheses ASD, shall be recognized as persons with disability for purposes of access to benefits and privileges under existing laws, including Republic Act No. 11-22-8 and other applicable statutes. The DOH, the NCDA, PhilHealth, and the LGUs shall establish and implement mechanisms to facilitate the registration of persons with ASD in the DOH Philippine Registry of Persons with Disability, in parentheses PRPWD, and ensure the timely issuance of disability identification cards subject to existing rules and safeguards. PhilHealth, in coordination with the DOH and the NCDA, shall develop, enhance, and periodically review benefit packages responsive to ASD-related health, rehabilitation, habilitation, and intervention needs, including appropriate inpatient and outpatient coverage, consistent with Republic Act No. 11-22-3 or the Universal Healthcare Act. Pending such development or enhancement, persons with ASD shall continue to avail of existing PhilHealth benefits and packages, and renumber the subsequent sections accordingly. I so move, Mr. President.
Any objection? Hearing none, the amendment is approved and adopted.
Thank you, Mr. President. In Section 8, renumbered as Section 10, Inclusive and Appropriate Education, from Senator Sherwin Gatchalian. On page 3, line 24, after the word support, insert the word AIDS. I so move, Mr. President. In Section 9, renumbered as Section 11, Employment and Livelihood, from this representation. On page 3, line 30, after the words disability laws, insert comma and the phrase, including the promotion of reasonable accommodations for neurodivergent individuals in the workplace, consistent with prevailing labor, disability, and occupational health standards. I so move, Mr. President. And lastly, in Section 14, renumbered as Section 16, implementing rules and regulations, from this representation. On page 4, line 26, after the word civil society organizations, comma, insert the words professional organizations specializing in neurodevelopment disorders to read as follows. Section 16, implementing rules and regulations. Within 90, in parentheses, numerals 90, days from the effectivity of this act, the NCDA, in consultation with the DOH, JRRMMC, PhilHealth, DepEd, CHED, TESDA, DOLE, CSC, DSWD, LGUs, other concerned government agencies, civil society organizations, professional organizations specializing in neurodevelopment disorders, autism self-advocates, parents groups, and other stakeholders shall promulgate the implementing rules and regulations. I so move, Mr. President.
I think we should not mention it, if you don't mind.
I believe, Mr. President.
I've seen it. I've seen it in many laws that we have, many bills that we have passed. That become into law. Sometimes we could not effectively implement the law because the IRR is not finished.
Not
Meron
released
mataon eh.
or contrary to what is embodied in the law,
Correct.
Mr. President.
Correct. Sometimes
So
it
maybe we
happens.
can take out if with the permission of the good sponsor, maybe we can just take out the provision which mentions the IRR.
Yes, Mr. President, I'm willing to not move
Please.
to
Yes,
propose this
and
amendment,
the best
Mr.
thing is
President.
for the Committee on Health to exercise oversight over this particular bill. That will be
That is a
better
good,
than an
that is a
IRR.
good amendment, Mr. President.
We'll
Oo,
do so,
that'll
Mr.
be-
President.
All right. Thank
No
you.
more,
Thank you then.
no further amendments, Mr.
No
President.
further-